Hi, I'm Tania from Sage Institute of Aged Care, and today we're going to demonstrate how to use the standing machine. This machine's used when we need to move a resident and they're not able to stand on their own. They must be able to stand or take weight through both of their legs to be able to use this machine. Alright, so we need to grab the sling and we need to put it low around the person's waist. It needs to be really low and firm around here. We need to make sure the resident's arms are outside the sling, and we're going to connect this part of the sling to the machine to move our resident. The standing machine, when it's parked or positioned in not being used, needs to have the brakes on and the legs need to be put close together. But when we use the machine, we're going to take off the brakes. We're going to, what we call, spread the legs so that we get the width in the base of the machine. Then we bring it in close to the resident. We need 2 people to do this job, and the second person's job is to make sure the resident is safe and secure while we're doing the moving. So Jackie now has to make sure that the resident's feet are placed on the plate appropriately without hurting the resident. Okay, we're good in. We also need to make sure that the plate touches into the legs of the resident so we don't have a gap there. This will help the resident standing up. Brakes must go on before we use the equipment and before we walk away from it. The sling has 3 different settings on it in regards to which one we use. We will have to talk through ourselves which one we want to use. And because of where Anne-Marie's positioned, we only really need to use the white one for this time. So it goes up and over. You don't need to worry about this bit. This bit actually shuts off and stops it from flicking back out. Double check our resident's arms are outside the sling, and we're going to get our resident to place their hands on the machine. Are you ready to go, Anne-Marie?
Yes, I am.
Okay, the machine's going to lift you up now.
Okay.
We use the remote control and the up arrow brings the machine up. So the resident will stand up. We need to have them standing in a reasonable position, not too low that they're sitting down and not too high that they're able to tip forwards. While we're doing this process, we have to remember the brakes still must be on. Are we good there?
Yep.
Comfy? Yep. You're holding on.
I am holding on.
Okay, we're going to take the brakes off now. Jackie is staying with our resident to make sure that they're okay and safe. We're going to swing the machine around. We have to be careful with the use of the machine because if we travel too far with it, we're transporting the resident, and that's not what this was designed for. It's for transferring them over short distances. Once the wheelchair's in position and Jackie says she's right to go, I'm going to put my brakes on before we use the machine again. We're going to lower the resident down, and Jackie's just going to make sure that we've got a good position for the resident. We're good? Fantastic. We're going to lower the arm down far enough that we can release the sling. So I'm going to come around this side. Oh, you're right. And release it off. Jackie needs to make sure that the resident's feet don't slide off the platform as they pull the machine away. So again, taking off the brakes, moving the machine out, and then I need to position the machine in a place that is safe. So I'm going to bring it over, put the legs back together, put the brakes on, and then I'm going to come back and assist with our resident. So what we need to do now is take the sling off. Can you lean forward for me? Fantastic. Pull out the sling. Check that the resident is safe and secure. We also need to put the foot plates back on the wheelchair. We will do that. Do I have one side? Thank you. So these are designed for the resident to put their feet on, comfortable again, and so their feet don't slide off and hit the floor. Remembering not to bend your back as you're doing this sort of work. We want to squat, we want to lunge, we want to get down, even on our knees if we have to stop our back from bending. We pop it in to here, slide it around. We're just going to get our resident to lift your foot for me. Thank you, Anne-Marie. Slide it around, making sure that the strap is behind the heel. That stops the resident's foot from sliding off. Now we're ready for our resident to go off for her cup of tea.
Yay!
And so that's how you use the standing machine. Remember, we use this for residents that aren't able to stand on their own and we need to move them to another position or into a wheelchair. I hope you found that useful. See you next time.